Let's talk about allergy. Very important for the NCLEX exam. Very important for the NCLEX exam. Now, this is it. Allergy on the NCLEX exam. This is what you need to know. Anytime you see any answer keys related to allergy, please select that answer. That answer is correct. Whether the nurse is asking question about allergy or one of the answer keys showing sign of allergy or showing past history of allergy on your answer keys, please select the answer, because allergy don't put the NCLEX don't put allergy on your answer keys for fun. It's very important and it's a safety concern. That is the reason why the NCLEX is putting it on the answer key. Right now, this is one thing I want you to know. The reason why I'm telling you to select the answer is because, one, I understand the NCLEX. The NCLEX is a safety exam, right? So every answer are related to one safety concern or the other, right? So if NCLEX is testing on allergy, automatically they are testing you on safety. They might not test you and say, okay, which of the following is a sign of allergy or something like that, but they can give you something related to allergy in form of what? Maybe they are testing in form of medication, procedure, what other things? Medication, procedure, okay, food, right? Procedure might be maybe you are trying to do a certain kind of uh, investigation or surgery, right? So we need to now find the material for investigation. That can be like contra dye, right? And surgery can be your latex product, food like shrimp, shell, fish, medications also like your antibiotics, NSAID, medication like your aspirin, ibuprofen, right? Right, your antibiotics, penicillin, amoxicillin, cephalosporin, if I'm pronouncing that right. Right, cephalosporin. Right, so yeah, you can see now all these things. NCLEX is not trying to test you all these things because they just want you to identify what sign of allergy or something that can cause allergy. Right, environment is also part, but it's not really a big thing on the NCLEX exam. Now, right, if you are having medication, NCLEX is going to test you based on medication, but big thing is that all these things that cause allergy are going to show general sign. Now, is it that it's going to show something like rash, hives, inching, right? Inching. All right. This can be your mild um symptom, whereby you just need to give antihistamine medication, right? But if you have something like shortness of breath, or the NCLEX is saying dyspnea, right? Hypotension, shortness of breath, dyspnea, hypotension, right? This is severe. We give what? Epinephrine. Epinephrine for this. This is severe. We give epinephrine for this. Right. Very important. Very important. Right. So you need to know mild antihistamine. That's your antihistamine. Why is my something? Antihistamine. Right. And this will be your epinephrine. Right. So, oh my god. Right. Epinephrine. So, yeah, antihistamine epinephrine for severe. Right. So now this is what you just need to know. Now, whatever they are taking here or any procedure they are doing, be it medication, procedure, food, they are going to show up as this. Right. It can show up mildly or what? Severe. That's what you want to know. Now, anything that is causing allergy, guess what? We want to stop it. That's our first priority. To stop it, right, assess the patient and then report to the doctor. So stop, assess the patient, what? Report to the doctor. Right. Stop is the first thing, assess the patient, report to the doctor. Know that order. Right. But you want to know now, NCLEX can test you in form of a particular procedure. Now maybe a patient want to do blood transfusion and then maybe they have history of so kind of allergy to latest products, right? Then we need to let the doctor know about it, right? Or NCLEX might tell you which of the following order should you question based on a patient that recently have allergies to so maybe penicillin, and then one of the medication is amoxicillin. Amoxicillin and penicillin they have the same thing in it, so they are going to have what, the same allergy feeling. Also, another thing you want to know is what we call vaccine as well too. Right. A lot of people have allergy to vaccine. Right. One thing you also need to know. Now, but the whole goal of NCLEX is not really to bother you a lot, but they just want you to be able to identify situation that can cause what, allergy. That is the whole goal of the NCLEX, right? They just want you to know situation that can cause allergy, right? Like, uh, if you look at this particular question, now we know a procedure can lead to allergy. That is the main reason why the nurse is going to ask, what allergy do you have? Because the nurse identified that some certain procedure can cause allergy. That's the reason why the nurse needs to know. Now, also, it can be maybe when we are inserting urinary catheter, right? And the NCLEX, or we are doing a certain procedure and we are going to use what? Contrast dye. Also, iodine to its part for allergy, iodine, right? Or contrast dye, we're using contrast dye, and then we are trying to like find out if the patient's kidney is working well. Right. That way we are checking the BUN and what the creatinine. Because we want the contrast dye to be out of the body through the kidney. So if the kidney is not working well, guess what? It will not be able to leave the body, and guess what, it can start causing problem. Later start showing, maybe patient might now start having allergic reaction to it, right? And that will be bad for the patient, because we don't want that particular dye in the body after we've done what we want to do, right? Certain procedure, definitely we need to ask for allergy, right? um that's another thing. Now you can see this particular question, right? Look at what the question is asking, but look at the answer key. Now, the moment I just see this on my answer key talking about allergy, even if I don't know about the question, based on the standard principle of the NCLEX safety, there's no any safety concern that can be paired with this already, because this is showing what, sign of allergy, and allergy is a safety concern on the NCLEX exam. Big safety concern on the NCLEX exam, right? So definitely I will select this as my answer, even if I don't know anything about this question, right? Because it's a safety. If you see it on the NCLEX exam, whether the nurse is asking question or they are telling you sign of allergy, trust me, it's very important, right? So yes, but if you look at the question, there's a certain procedure going on. The NCLEX is asking you what is priority to what, follow up, right? The patient that is having allergy is priority to follow up, in a sense that if we do this procedure, we don't know if this patient is allergic to what, latest procedure. So if we equipment, right, if we use maybe an equipment containing this, guess what, the patient might what, react to it, and then there will be problem. So that's the reason why I want to follow up. So that's how the NCLEX work in regards to allergy. But the big thing you need to know is that you need to know allergy can be from medication, procedure, food, right? Common food, shrimp, shellfish, medication, antibiotics, NSAID, procedure such as your contrast dye, iodine, latest material, right? So NCLEX can either give you sign of allergy in your answer keys, select it as your correct answer, or NCLEX can maybe ask a question. Maybe the nurse is asking question about allergy, select that as well too as your correct answer. Now remember, we have the mild aspect and then we have the severe aspect. Now the mild aspect, they take antihistamine, the severe aspect they take epinephrine. Right now, if it's severe shortness of breath, most likely we might assess the patient, and then oxygen is low. Definitely, we need to administer what, oxygen to the patient, right, as prescribed. And as well too, if the patient is having hypotension, if the patient is having shortness of breath, dyspnea, we want to place the patient high Fowler, administer oxygen, right? I'm saying this because if you see this on your case study, you know you are going to have multiple answers. Or if you select or apply, you have to have multiple answers. So I'm just making you aware of answers that will definitely be correct. Reporting to the doctor is definitely going to be correct if you select or apply or case study, right? High Fowler, definitely correct. Administering oxygen, definitely correct if the oxygen is low in that case study, right? But if it is standalone, the first answer you are looking for is to stop what is causing the allergy. If you are not seeing stop, then the next thing is to if it is severe, then we are looking for maybe to administer epinephrine, right? But if it is mild, we are giving antihistamine. But if you are not seeing any of this, then the next answer you should be looking for should be to report to the doctor. But trust me, these are your answers. Right. Stop, access, or if there's no stop, maybe they want you to give epinephrine or antihistamine depending on what the patient is experiencing. The patient is having severe situation, we don't give antihistamine. Antihistamine will not work for severe situation. So epinephrine, right? And then we can report to the doctor. And don't forget, documentation is also a big thing on the NCLEX exam. So if documentation is part of that answer, if you select or apply or case study, select it as well too. Now for hypotension, we want to place them supine. For hypotension, we want to place them supine and elevate their legs. So patient is just like this. So we are elevating their legs, right? So the leg is elevated while they are lying in a what? Supine what? Position, right? So yes, right, because it helps with what? Hypotension. If a patient is having hypertension, we want to place them what? In a high Fowler position. High Fowler position work for hypertension, but supine and elevating the leg of the bed help a patient who's having what? Hypotension. So this is everything you need to know about allergy. Always make sure you wash out. If you see allergy on your answer key, please select that answer. I will see you in my next video.